So we can perform a similar technique using a foam roller. The foam roller is generally not as dense as the ball, and because of the shape and size, doesn't have the same degree of impact, which may be more comfortable for those who don't have a high level of pressure tolerance in that area. Technique guidelines are the same, so basically bringing the leg into flexion or flexion and rotation, and then using the opposite leg to guide that roll forwards and backwards over the roller. We can perform a self-release technique for the adductors using the foam roller. So basically lying in a three-quarter prone position with the inner thigh in contact with the roller, and then from there performing a transverse plane movement with the pelvis whilst actively pushing down with the leg to elicit some pressure against the adductors, and then performing this type of movement so that we're rolling into the inner thigh. So if we have some restrictions through TFL, we can use another self-release technique for that. So basically finding your TFL usually sits between the ASIS, the bony part at the front of the pelvis, and the greater trochanter, the bony part on the side of the hip, placing the ball in that area, and then taking the body weight on the ball, and again performing circles or performing movements around that area until you hit areas of increased tension or tightness, and then basically holding that sustained pressure or performing very small circles around that area of tightness. So one example of a position where we can stretch the hip into internal rotation is side lying. So we'll demonstrate this stretching the left leg. So we'll be lying on the left side, so the affected side on the bottom, wrapping a band or strap around the foot, bending the hip up to 90 degrees of hip flexion, and then from there allowing the foot to hang down towards the floor to initiate the stretch, and then we can reinforce the stretch by using the strap and pulling the foot up towards the head. Hip internal rotation range of movement may also respond to an inferior glide of the hip joint, as demonstrated previously in relation to hip flexion mobility. And this may also be performed as a mobilisation with movement. So again, we'll be working on the left hip. So wrapping a strap around the top of the hip joint, and then placing the foot of the opposite leg in the strap. And from there, exerting a strong downwards pressure with the right leg while actively moving the left hip into internal rotation. It's pulling down and then passively rotating or actively rotating the left hip. We can perform an active stretch into hip internal rotation, and one example of a position where we can do this is in sitting. So basically sitting with the feet approximately 1.5 hip widths apart and the knees bent to approximately 70 to 90 degrees of knee flexion. From there, keeping the pelvis relatively stable, we're performing the hip internal rotation movement by bringing the knee down towards the floor and then back in the other direction. Knee down towards the floor and back in the other direction. Just making sure that we're not rotating the pelvis excessively. We want to keep the pelvis relatively fixed, so we're isolating that stretch to the hip. We can also use other PNF techniques such as compression and distraction to elicit an improvement in hip internal rotation range of movement. With compression, we're basically using the hands to pull the leg downwards and basically compress the head of the femur downwards into the joint or posteriorly into the joint, and then from there winding into hip internal rotation. Compression and internal rotation. An alternative position for this would be in quadruped, where we're using the weight of the body to provide that compressive element, and then from there rotating the body away from the foot so that the hip moves into internal rotation. We can also perform a distraction force. The easiest way to do this, if we're not using partner assistance, is to use the hands and basically pull on the knee, pulling the leg away from the hip joint, and then rotating inwards from there. So pulling away, rotating in.